Imagine a dormant virus in your body suddenly waking up and causing a rare and often fatal brain infection. That's the shocking reality of progressive multifocal leukoencephalopathy, or PML. This disease caused by the JC virus often lurks unnoticed in our bodies. But when our immune system is weakened, the virus seizes the opportunity to attack, resulting in PML. The symptoms of PML can be devastating, including clumsiness, speech difficulties, blindness, and cognitive decline. The most alarming fact is that there is no specific treatment for PML itself. The approach is to manage the underlying immune disorder in an attempt to prolong survival. This reality sounds grim, I know. The mortality rate is high, with death usually occurring within 9 months of diagnosis, yet understanding PML is the first step towards fighting it. Now that you know what PML is, let's delve deeper into how it's diagnosed. Diagnosing PML isn't as straightforward as you might think. To identify this rare brain infection, doctors typically employ a range of methods. Medical imaging, such as MRIs, can help visualize the damage in the brain, but the symptoms vary widely, making the diagnosis quite tricky. From clumsiness to cognitive decline, PML can manifest in many ways depending on which part of the brain is affected. Even more complex is the role of the immune system. The JC virus, the culprit behind PML, remains dormant in most people. It's only when the immune system is weakened that the virus springs into action, causing PML. So to diagnose PML, doctors also need to confirm that the patient's immune system is compromised. On top of all this, there's another step, a spinal tap. This procedure, also known as a lumbar puncture, allows doctors to examine the cerebrospinal fluid for evidence of the JC virus. It's a critical piece of the puzzle in diagnosing PML. In conclusion, diagnosing PML is a multi-step process involving imaging, symptom assessment, immune system evaluation, and a spinal tap. It's a journey that illustrates the complexity of our brains and our immune systems. But what are these symptoms we're talking about? Let's find out in the next segment. The signs and symptoms of PML can be as diverse as they are devastating. Progressive multifocal leukoencephalopathy, or PML for short, manifests itself in a variety of ways. Picture this. One day you're perfectly fine, going about your daily routine, and then, out of the blue, you start to feel a little off. You might experience clumsiness, as if your limbs aren't quite listening to what your brain is telling them to do. Or perhaps you might find yourself struggling with speech, stumbling over words that were once so familiar. In some cases, PML can even result in blindness, a terrifying prospect for anyone. But perhaps the most heartbreaking symptom is cognitive decline. Imagine losing the ability to think clearly, to remember loved ones, or to carry out simple tasks. The symptoms of PML can differ greatly from one person to another, making it a truly unpredictable disease. It's a chilling thought, isn't it? With such severe symptoms, you might be wondering how common PML is. PML is rare, but when it strikes, it's often deadly. This brain infection, caused by the JC virus, typically affects those with weakened immune systems. The incidence rate of PML is low, but don't let that fool you into a false sense of security. This disease does not discriminate, striking both males and females alike. After diagnosis, the clock starts ticking. The average survival time is usually within 9 months, emphasizing the severity of this disease. But don't lose hope. While there's no specific treatment for PML, managing the underlying immune disorder can help prolong survival. and there's more. The medical community is looking towards immune checkpoint inhibitors as potential allies in the fight against PML. While their efficacy is not yet confirmed, they show promise in managing this devastating disease. PML is a devastating disease, but understanding it is the first step in fighting it. Like, share, comment, and subscribe